Good morning. My name is Robert Ryberg, and this is an interview for Stephanie Tucci. I'm a current MBA, MPH student at University of Arizona. That's Master's in Business Administration and Master's in Public Health. My emphasis is on healthcare entrepreneurship, and I've been here for one semester. My educational background is I have a bachelor's in paralegal from University of Utah. Um, I initially wanted to go into legal work and be an attorney. Um, Along the way, I kind of ended up in healthcare by accident. 2 years into my bachelor's degree, I was working for a inpatient residential treatment facility in Orem, Utah, and figured that I really liked it. So I completed my degree in paralegal, and as soon as I finished, really just immersed myself in healthcare, and I've been there ever since. So it was kind of by accident. The facility I was working for in Utah was called Cirque Lodge, and I started as a clinician there. I started working as a counselor and worked my way up to an admissions coordinator, where I was responsible for 8 employees and coordinating transfer from clients from various detox centers across the country to our residential facility. Um, Now, I liked that because I had some experience in the clinical setting. I I spent some time attaining my certification in the state of Utah for what's called an LSAC, a licensed substance abuse counselor, and really just found out that I didn't like it. Um, it was it was kind of too close to the heart and too much, so I was able to take an administrative switch and kind of take some separation there, and I really enjoyed that. So after that I worked for Cirque Lodge for about a year. I was responsible for all admissions work there. It was great. I was offered a job back in Crystal Lake, where I'm from, and so I came back to work for a company called Employee Health Consultants. And at Employee Health Consultants, I did two things. I was a program coordinator as well as a clinician. So I did half and half. I maintained a caseload of about 6 clients, and I also directed a program for adolescents. We created a substance abuse treatment program as well as a substance abuse education program, and I was responsible for the entire creation of that, marketing, and really curriculum for it. So I really enjoyed that. It gave me the opportunity to really grow within a small company and do some entrepreneurial work. Um, how much school? Let's see. So I went to my bachelor's took me just short of 4 years. I completed it in 3.5 years, and I'm working on my master's degree now. It should take, because it's a dual degree, it'll take me about 3 years. So that's a total of about 7 years. Um, the average pay for administration and healthcare really varies. Administration is kind of subjective in healthcare. It's traditionally hasn't been a business related field. People have kind of taken interest in specialized sectors of healthcare and then worked their way up within. And so essentially, the idea of going to school for business within healthcare is kind of new. Um, Most people go for like an MD, an MHA, MPH, MPA degree, and uh, and kind of work their way up. But so I will have spent 7 years in school by the time I'm done. Um, Typical pay, ranges from $60,000 to I've seen hospital administrators making $300,000. Uh, that's really interesting because primarily hospital settings are nonprofit. Um, you see, I don't know, maybe a quarter of them as profit facilities. So you see a real diversification of salary. Uh, Growth in field. Like I said, I live in Arizona, and down here, in the Sun Belt, we see like a lot of baby boomers, a lot of retirees, and so down here, there's a huge need for hospice and for continued care. Um, there's quite a few retirement facilities, so I can speak to down here. The health field is growing immensely. I do know that between now and 2018, there's supposed to be a growth of like 3.2 million jobs in healthcare, um, as a result of the healthcare changes here in the U.S. as well as internationally. They're supposed to positively benefit the healthcare industry as far as employment. Um, Administration for me was important because although I enjoyed clinical work from a psychiatric standpoint, it was a little close to my heart. I come from a history of there's addictions within my family, and so it was a little close to my heart and a little tough to work with. So administration kind of puts me right level in between the ability to work with clients and the ability to choose what's being done for them. So I really enjoy it. That being said, and in 10 years, I'm hoping to see myself as a hospital administrator. Ideally, I would like to remain in behavioral health, but it's an interesting field as a lot of the private facilities are held that the equity is held by like 5 to 10 shareholders, and they typically work within the facility, so it's difficult to work your way up within there. I would say that within 10 years, I'd like to work at an operational level within administrative healthcare. So probably a regional hospital, or possibly an insurance setting. So yeah, if there's any other questions I can answer, you can contact me at my email is robertericryberg@yahoo.com. Thank you for your time.